My name is Priscilla Agbovi. I'm the public health nurse for the district and also the HIV coordinator for the district.
Okay. So when they say someone is an HIV coordinator, what does it mean?
It's just a person who supervises HIV activities and ensure the quality implementation of the program within the district.
For those who don't know, what is HIV?
HIV is actually an abbreviation, so it means human immunodeficiency virus. So that's the full meaning.
So
and
what's the difference between HIV and AIDS?
so HIV, it's when your immune system as an individual, it's broken down when you are attacked by the virus. And if you fail to do treatment for this HIV, it progresses to another stage,
Okay.
which is the AIDS.
So the progression is what we call the AIDS. Or
Yes,
when it
please.
progresses, that's when.
Yes, please.
Okay. What are some of the activities you embark on as an HIV coordinator?
Thank you. So when it comes to activities, one, we normally do supervision
Okay.
of the various activities that we do when it comes to HIV. We also ensure the availability of logistics that is used at the various sites. So the medication, the kits for testing, the registers, all those things. We also, the nurses within the unit also go out for what? Health education, both on radio, CIC, yes. So
What's your most recent activity you've done in the district pertaining to HIV?
yes, for health education, we always do it. The recent one was screening. So we screen. Yes, it was done at Agopo. Yes,
What's the date?
that was December.
Last
Yes,
year, December.
yes.
So it means the whole of this year you've not done any HIV engagement.
Just the health education.
Okay.
Yes, as the reason why we normally don't go out again is that if you go, people are afraid of coming.
Okay.
They are afraid of texting when people are
I
around.
think the last time I saw you at the market
Yes.
area.
Yes, I think that was even this year, early this year. What we observe is that when we go out, people are afraid to come. But when we give education, they rather, come to the facilities by themselves
So-
to do the testing.
What do you think is the reason for this?
It could be stigmatization. It could be stigmatization. Once we set a table, this place we are doing screening for HIV. If you go there, someone might not even know the outcome of your results, but so far as they see you there,
Yeah.
you know what they will talk
Think about
about.
it.
So
So apart from the stigmatization, what has been the response like in the district towards HIV related issues?
well, towards HIV related issues, it's not been too good. Yes, it's not been too good. You don't see people, walking in, even if the opportunity is given to them where we go out to do screening, you don't see them coming forth for screening, as I've rightly said. So it's quite a challenge.
Okay. Looking at HIV in the district, give us a breakdown and what's the contraction rates like?
Oh, okay. So when it comes to HIV in the South Tongue district, I'll give you data on half year
Okay. That's
from January to June.
June. Okay.
Yes, please. So from January to June this year, we tested about 4,263 of our clients.
Okay.
The walking, the pregnant women, the children, everybody. So out of this figure, 13 of our pregnant women tested positive.
Okay.
And then for the males, about 22 of them tested positive. The females, about 53 So making a total of 88 people who are tested positive for the half year 2023.
Comparing this figure with other districts, do you think South Tongu is a bit better?
It's not. It's not. I won't say it's better. Though other districts are higher. I think we are about the fourth or fifth when it comes to, yes. I think we should be around that age.
That when it comes to HIV in Volta region?
Yes, please.
Okay.
Yes. So that's it.
So speaking about the pregnant women, you said there are 13 of them with HIV. How does this affect the baby as pregnant women?
It's a yes, it's a no. It's a no because if the mother is tested and is positive, she is being counseled, and then once she accepted, she is being put on treatment.
Okay.
So if this woman is taking the medication holistically, without any break, without, any default, both the mother and then the baby are safe. It's a no. If this mother who tested positive refuse to either accept the outcome of the result, or she has accepted the outcome of the results but refused to take the medication, then there is a challenge. It could affect the baby. And in the process of delivery, we encourage these mothers not to deliver home or to be delivered by anybody unless she is supposed to come to the hospital to deliver. Even if it is the home, we encourage her to be delivered by a skilled person.
Why is this? Why?
Yes, as I've rightly said, because of the process of labor, if that process is not handled very well, there is possibility of transmission.
Okay.
Yes, of the virus to the baby.
So she needs experts to do that?
Yes, please.
Or trained health professionals?
Yes, please.
Okay. Now, coming to something that was circulating on social media, I think last week, about the number of HIV people or persons in the district. Have you seen it?
Yes,
if
please.
Yes, how true is this information?
Yes,
on the
I've
flyer,
seen
it
it.
says 1,075 people are living with HIV in the district. How true is this?
Yes. It's actually a figure that is pulled out by one of the regional coordinators. So someone may ask, where do we pull these figures from and how come we come about these figures? So we have a system now, and anybody will testify that if you go to the hospital now, all your information are key into a system.
Okay.
So we pull these figures from that system.
Okay.
Yes. The number of people who are having HIVs, and it's a cumulative figure.
So when are we looking at? When did it start?
Yes, so actually the treatment site at District Hospital, which is the first, started somewhere 2007.
Okay.
And that of Richard Novati, I think 2019 or so,
Okay.
that it started. So cumulative figures of all these sites, including the other HIV sites in the district, as this figure.
Okay, that makes sense. So what measures are you putting in place to make sure that the virus does not spread in the district?
Thank you. So when it comes to the measures, health education is one of the key activities. The education must always go, and once people are listening to it, they know that there is something called HIV and how to acquire it. So we give education a lot. And after giving the education, even those of them who are testing, and then if you test negative, we counsel you on good behaviors so that you maintain being negative. And same if you test positive, we still counsel you. We counsel, and then we put you on treatment. That is if the client accepted. And once you're on the treatment, I mean, we hope everything will be okay. Unless you are somebody, though you take the treatment, you don't follow as is expected of you.
Looking at also, let's go back to the number of people living with HIV in the first half of the year. Do you think that figure can grow, or we can maintain it so that it doesn't grow?
It can grow. It can grow, and it's looking at, I mean, our behavioral pattern these days, whereby even if you go to schools and you are giving education on HIV or on sexuality, I mean, the response when it comes to the spread of HIV or the prevention, most of the times we base our education on ABC.
Okay.
I mean, where the A, we tell you to abstain. That is, if you are somebody who is not practicing sex already, we encourage you to abstain. But if you are somebody who has already started having sex, we encourage you on what? Being faithful. And if we talked about being faithful, as a man, you have to be faithful. As a woman, you have to be faithful to your husband, to your partner. Yes. And the C, if you are talking about the C, is about condom use. And when it comes to condom use, we talk basically about the 3 C's, which are correct use, consistent use, and then continuous use, whereby anytime you want to have sex, you are supposed to use this condom, and it should be used correctly, and it should be used continuously. Anytime you want to have sex, you should use the consistency, with the sense that if maybe, especially the correct and then the continuous, if somewhere along the line you didn't wear it well, or during the process it has even tear before it's being put on the penis, still you are not being protected. If somewhere along the sexual act you decide to stop using the condom, maybe you have removed it and you continue with the act, still you are not being protected. So that is it. When it comes to, so we basically encourage people. And when it comes to being faithful, I mean, there is something that I always called a chain relationship, whereby you see men, women, assuming I have a partner, I'm not being faithful, that one partner is not being faithful, the person go out to have another partner. So if that partner is also the other person, be the side chick, who is also having another boyfriend, and that boyfriend is also having another girlfriend, so within the chain, if one person is having the virus, definitely it will spread among these people. So that is what is happening now within the districts. But we are still encouraging people to be faithful. We are encouraging people to use the condom, especially because we believe that condom use consistently, correctly, and continuously, I mean, will help us.
Let's put it into perspective. Looking in the district, what do you think is the number one thing that is making people contract the virus?
Thank you. When it comes to the contraction, normally the figures that we normally get from maybe from mother to baby is quite small. So for that one, I mean, once the mother is on treatment and the delivery process is managed well, we are safe. But in the process whereby maybe people are already practicing sex, yet they refuse to be faithful, if I can put something like that, or they refuse to use condom, then there is a challenge there, because these are the major things that will, I mean, help spread the virus quickly.
Okay, finally, what message of hope do you have for anyone listening to us living with HIV?
Thank you. So when it comes to people living with HIV, we love them. They are one of us. HIV is not a death sentence. It's just like any normal condition. that you go to the hospital, you take your medication, and then you are taking the medication, and definitely you'll be fine. It's the same when it comes to HIV. Once you've tested positive, it doesn't mean you are going to die. No. You test positive, you are cancelled, and then you are being put on treatment. And once you're on this treatment, nothing will happen to you. So there is still hope. Nobody who says, oh, I'm HIV positive should not lose hope, because there is hope, and we love them all.
Thank you very much.
You are welcome.